All right, so Hina Sheth here from Rebalance Physical Therapy and Wellness. The 3 things that you should do if you've hurt your low back and the pain is localized to your low back and you're about to go on a trip somewhere, all right, plane, car, whatever it is. Okay, number 1, you need to ice. Oh, well, first of all, number 1, get yourself into a position that's comfortable. Now, most of the time when somebody has hurt their low back, typically the positioning that most people find is the best is actually being upright, kind of in almost like a standing or a little bit of an arched position with their back. All right. So if you've hurt your low back, bending and twisting is typically going to be the 2 motions that are going to make this worse. So you want to get out of that motion. All right. And if you have to sit, you want to sit with your back slightly arched, or you want to stand, or you want to lie on your stomach, because that will kind of get you into more of a neutral or an extended position. Number 2, you want to ice your back. For the first 3 days of an acute injury to your low back, again, one that's not going down into your leg, but this also pertains with going down into your leg. But you want to get an ice pack, all right? And for 10 minutes, you want to ice your low back, or up until the skin area where that ice pack is goes numb. As soon as it goes numb or it's been 10 minutes, you want to take that ice pack off, right? You can ice several times throughout the day. I've had patients ice every hour for 10 minutes. But for the first 3 days, please ice. Do not heat, like I mentioned in the previous video, okay? Now, the icing, the reason why you are icing is because it helps to reduce all the inflammatory process that is starting to go on, initiating the healing pieces that are going on, all right? So that is why ice is important. Now, I know there's some controversy out there. Some people will be like, you shouldn't ice, you should ice. I'm a believer that, hey, if you're about to go on a trip and you need to get there, get yourself out of pain so you can get yourself comfortable, because if you are in pain, you're just going to compensate in other ways. So if you don't have the luxury of time and to be able to just hang out at your house and really let the inflammation process do its thing, then you're going to have to help it. You're going to have to help put some ice on it and calm down that inflammatory process so you can get out of some pain, right? And then number 3, when you travel, make a towel roll, all right? This towel roll is just, I made it out of rubber bands and like a bath towel. You can sit on this towel because that's going to help you put you into a nice neutral, a little bit of a back extension or arched back. You can actually put this in the low part of your low back because that's going to support you and keep you upright. You can put it horizontal or you can put it vertical. And this was a lifesaver on the plane for me, all right? Now, those are the 3 things that I recommend. I'm going to tell you a 4th, but the 4th, I'm going to put a little caveat in it because, again, there's a lot of controversy out there. When I went on my trip, I did take NSAIDs or anti-inflammatories around the clock for about 2 to 3 days. Now, it's a personal decision. You would, I always have to say, I'm a physical therapist, I'm not a physician, so you need to check with your physician, pharmacist, whoever, to make sure it's okay for you to take NSAIDs or anti-inflammatories. But for me, anti-inflammatories were really, really important because I needed to sit on a 12-hour plane, take care of 3 kids, and I also wanted to be, comfortable for my vacation and active. So I did take NSAIDs around the clock for 2 to 3 days. Now, when this process is going on, I want you to think, okay, I need to be protective of my back because the first typically 3 to 4 days, that's called acute pain. You need to kind of nurture and help it. And you don't want to, if you're in so much pain, you're going to end up compensating in other ways. You're going to be limping. You're going to be moving differently. For me, I had other things start popping up because, my back pain was pretty significant. I had rib pain after a while, and then my neck started going out. This can easily happen to you guys. So why not do as much as you can to kind of help that process along? All right, especially if, like I said, you have to be on a plane, you got to be active. So I would say if you choose to take inflammatories, it's a personal decision. I did, you could too, and then that is definitely going to help your pain quite a bit. And I think between those things, you're going to at least comfortably get yourself to your destination. Now, in the next video, I'm going to talk about once you get off the plane and now you're in a place of like you're going to be there for a week or two, how do you navigate through that when you don't have access to a physical therapist to tell you kind of what to do? So in the next video, I'm going to talk about what you can do and in the series, what you can do to kind of get yourself better while you're on vacation. So see you in the next video.